Okay, so you know how it is, right? When you're trying to get a handle on something complicated and all of a sudden it feels like you're drowning in information.
Yeah.
Like, where do you even begin?
It can be overwhelming.
And that's where we come in.
Absolutely.
Because today we're going deep on something that you might actually be dealing with yourself, or maybe you're just really curious about it. Hypogonadism.
Yeah, we're going to break it all down for you.
It's your express lane to really understanding what matters most.
That's right. We've gone through all the research, the nitty-gritty details,
Yeah,
and we're bringing you just the essentials.
that's right.
So in a nutshell, hypogonadism is basically a condition where your gonads, and remember, those are the testes for men, and the ovaries for women, they just aren't producing enough of those crucial sex hormones.
Okay.
For men, we're talking about testosterone.
Right.
And for women, it's estrogen and progesterone.
Okay, so let's back up for a second.
Okay.
Because when we hear sex hormones, our minds immediately go to...
Sex drive libido.
Yeah, exactly. Yeah. But it's not just about that, is it? It sounds like it's a much bigger deal for your body.
Oh, it absolutely is. You're right.
Yeah.
While sexual function is definitely a part of it, those hormones are kind of like the VIPs of your body.
Oh, wow.
They're running the show for so many different functions.
Yeah.
We're talking about how you develop sexually, your ability to have kids.
Right.
And even like your overall metabolic health.
Okay.
And how much energy you have running around day to day.
So big implications then.
Big time.
So we're going to break it down,
Yes.
the causes, the mechanisms, the symptoms, the diagnosis, the treatments.
No holding 9 yards.
But to give you a bit of a roadmap through all this info,
Okay.
we really need to lay out the two main ways hypogonadism can actually develop.
Right.
Right.
Absolutely.
So either the problem is with the gonads themselves,
Right.
or it's like a miscommunication coming from the brain.
Exactly. A signaling problem.
Yeah.
Yeah.
So that's really the heart of the difference between primary hypogonadism, where the gonads are the main issue.
Yeah.
Right.
And then you have secondary hypogonadism,
Right.
where it's actually the hypothalamus or the pituitary gland.
Yeah, the control center.
Yeah, the control centers in your brain that are kind of calling the shots.
Yeah, they're the ones sending those signals to the gonads, telling them what to do.
Right.
Yeah.
So let's start with the super basics.
Okay.
What is hypogonadism?
Okay. So in the simplest terms,
Yeah.
hypogonadism is when your gonads
Okay.
just can't produce enough of those key sex hormones
Right.
we talked about.
Yeah.
And this can have a ripple effect on your body, right?
Yeah.
It can mess with sexual development, your ability to have kids, how your body uses energy.
Yeah.
And it's important to remember, this isn't always something you're born with.
Right.
This can actually pop up at any point in your life.
Yeah, so it can be congenital, meaning you're born with it,
Right.
or acquired,
Exactly.
meaning it develops later.
Later on, yeah.
Okay, so let's dig into why it happens in the first place.
Yeah.
What causes hypogonadism?
And that's where we really see the split between primary and secondary causes.
Yeah, that's where that distinction becomes really important.
Yeah.
Okay, so let's start with primary hypogonadism.
Okay.
And here, the issue is with your gonads themselves.
Okay.
They're the problem.
Right.
Now, sometimes this is due to things that are there from birth, what we call congenital factors.
Oh, like genetic conditions.
Yeah, exactly.
That could affect you.
So, for example, in men, one of the more common congenital causes is Klinefelter syndrome.
Okay.
And that's where a guy has an extra X chromosome.
Okay.
So instead of the typical XY,
Right.
it's XXY.
I see.
And then in women, there's Turner syndrome,
Yeah.
where a woman is actually missing an X chromosome.
Right.
So instead of the usual 2X's, XX is just XO.
Right.
And both of these can lead to primary hypogonadism.
Right.
Now, another condition we see is androgen insensitivity syndrome.
Okay.
And this is where the body just doesn't respond properly to testosterone.
Even if it's there.
Even if it's there, exactly. And then there could be cases where the testes in men or the ovaries in women just don't develop the way they should right from the start.
Yeah.
Like congenital anorchia in men or ovarian dysgenesis in women.
Oh, wow. Okay, so those are all things that you could be born with.
Right.
That are going to directly affect your gonads. But
Yeah.
what about things that could happen to you later on in life that could also affect your gonads?
Yeah, so those are what we call the acquired causes of primary hypogonadism.
Okay.
And these can be things like autoimmune conditions,
Okay.
where your own immune system is attacking your gonads.
Oh, wow.
So this could be autoimmune ophiritis affecting the ovaries
Right.
or orchitis affecting the testes.
Okay.
And then another thing that unfortunately can damage the gonads is cancer treatments,
Right.
things like radiation therapy or chemotherapy.
Yeah.
And then there's always the risk of physical trauma or surgery
Right.
involving the gonads and
Yeah.
even infections.
Really?
Yeah, like mumps. can sometimes cause lasting damage
To your gonads.
to the testes, yeah, leading to orchitis.
Wow. Okay, so
It's
that's,
a whole range of possibilities.
yeah, a lot of different ways that they can directly be impacted.
Absolutely.
Okay, so let's shift gears a little bit now and talk about secondary hypogonadism.
Okay.
So in this case,
Yeah.
your gonads might be totally fine,
Right.
but they're not getting the right instructions from the brain.
Yeah, the communication lines are down.
Right, exactly.
So what could cause that to happen?
Yeah, what causes that miscommunication?
Well, with secondary hypogonadism, the root of the problem is in your hypothalamus or your pituitary gland,
Okay,
both of which are up in your brain.
right.
And just like with primary hypogonadism, there can be congenital reasons for this, meaning you're born with it.
Okay.
One example is Kallmann syndrome.
Okay.
And in this condition, there's a deficiency of a hormone called gonadotropin-releasing hormone,
Okay.
or GnRH for short.
GnRH, got it.
Now, what's super interesting about this one is that it often comes along with anosmia, which is a reduced or completely absent sense of smell.
Wow, so you can't smell and you have hormone problems.
It's a strange link, right?
That is a bizarre connection.
It is.
Yeah.
But those two can go hand in hand.
Wow. Okay, interesting.
And then there can also be just developmental issues
Hmm.
that affect how the pituitary or hypothalamus form.
Right from the start.
Right from the beginning, yeah.
Okay, so that's congenital.
Right.
What about things that can go wrong in the brain later on in life that could lead to secondary hypogonadism?
Right. So when we're talking about acquired causes of secondary hypogonadism,
Yeah.
we often see things like tumors.
Tumors.
Yeah, in the pituitary gland.
Okay.
Specifically, these are called prolactinomas or craniopharyngiomas.
Okay.
And these are growths that can really mess with the normal production of different hormones.
Including the ones that talk to the gonads.
Exactly, the ones signaling the gonads.
Right.
Now, similar to those pituitary tumors, you can also have lesions or tumors in the hypothalamus, and those can interfere with the production of GnRH that we talked about earlier.
Okay.
And then there are certain chronic diseases that can also impact your hypothalamus and pituitary.
Okay, so it can be a full body thing that kind of trickles down.
It can be, yeah.
Wow.
So, for example,
Yeah.
there's hemochromatosis, where your body has too much iron,
Okay.
or sarcoidosis, which is an inflammatory disease.
I see.
And both of these can affect how your hypothalamus and pituitary function.
Okay, so not always a direct hit on the glands themselves.
Right.
But it can come from other places and still affect that whole system.
Exactly. It's all connected.
Right.
And then there's something called functional hypothalamic hypogonadism,
Okay.
which is really interesting because this one can actually be linked to your lifestyle.
Really?
Yeah.
Oh, wow.
So things like chronic stress, not getting enough nutrients, or exercising way too much,
Okay.
these can all suppress the signals coming from your hypothalamus.
So you're stressed out of your mind. Your hypothalamus is like,
I can't deal with this right now.
I'm shutting down.
Hormones, not a priority.
Wow.
And then high levels of prolactin, which is a hormone involved in milk production,
Right?
that can also inhibit the release of other hormones called gonadotropins.
Okay.
And those are the messengers that tell your gonads to get to work.
Right.
And then lastly, certain medications can throw a wrench in the whole system.
Like which ones?
Opioids, glucocorticoids, things like that.
Okay.
They can interfere with that whole hormonal cascade.
So lots of different ways
Yeah.
that this very delicate dance can be disrupted.
Absolutely.
Yeah. Okay. So we know the why now.
Right.
Let's talk about the how.
Okay.
How does your body actually get affected differently depending on whether it's primary or secondary hypogonadism?
Okay, so let's start with primary hypogonadism.
Okay.
So here, the problem is really at the source,
With the gonads.
with the gonads themselves.
Okay.
They're just not making enough testosterone or estrogen,
Even though they're getting the message.
even though your brain is sending those signals loud and clear. In fact, the levels of these hormones, LH and FSH,
Okay.
they might even be higher than normal.
Because your brain's like, hello.
Exactly. It's like the
Yeah.
brain is saying, hey, gonads, get with the program.
Yes.
But they're just not listening.
Right.
And it's this lack of sex hormones that leads to all the different issues someone might experience.
Okay.
So if it happens early in life, you might see delayed puberty,
Yeah.
problems with fertility, weakened bones leading to osteoporosis,
Right.
and even problems with how your body uses energy.
So it's a whole body thing.
It really is.
Yeah.
Now, with secondary hypogonadism,
Yeah.
the story's a little different.
Okay.
Here, the problem is with the signals themselves.
Coming from the brain.
Yeah, the hypothalamus or pituitary just aren't producing enough LH and FSH.
Right.
So the gonads aren't getting the memo to produce those sex hormones.
They're like, we're ready, but we haven't gotten the signal.
Exactly. They're on standby.
Right.
So again, you end up with low testosterone or estrogen. And this can affect both your reproductive system and other parts of your body.
Okay.
And the interesting thing here is,
Yeah.
because the pituitary gland controls a bunch of different hormones,
Right.
you might actually have deficiencies in other hormones too.
Oh, wow. So it could be more widespread
It can be.
than just the sex hormones.
Yeah, if the control center is having issues,
Yeah.
it can have a domino effect.
Wow. Okay, so let's move on to what you would actually notice.
Okay.
The symptoms.
Yeah.
What are some of the things that might clue you in to the fact that you could have hypogonadism?
Oh, okay.
And let's break it down by men and women and,
Yeah.
before puberty versus after puberty.
Sounds good.
Okay, so let's start with men.
Okay.
If hypogonadism starts before puberty, what are some of the signs that parents or,
Yeah. Or the individual themselves.
yeah, might pick up on?
Yeah. So you might notice that the typical changes of puberty are delayed.
Okay.
So the voice doesn't deepen.
Right.
They might not develop muscle mass as quickly, less facial and body hair than you would expect,
Okay.
and their testes might be smaller than usual.
Okay. So those are all,
Kind of external signs.
yeah, visual signs that something might be off.
Exactly.
Okay. And what about if hypogonadism develops later on in adulthood?
Okay, so in adult men, you might notice a lower sex drive, difficulty getting or maintaining an erection,
Okay.
feeling tired all the time,
Right.
and some men even report feeling depressed,
Wow.
having trouble concentrating.
Okay.
They might lose muscle mass and strength,
Right.
maybe gain some body fat.
Okay.
And it's even possible to develop gynecomastia.
Gynecomastia, what is that?
That's where breast tissue grows.
Oh, wow.
Yeah. And then over the long term, you might be at higher risk for things like osteoporosis
Okay.
and fertility.
Right.
And you might notice that your testes feel smaller or softer.
Okay. So pretty significant changes.
They can be, yeah.
That could really affect your life.
Yeah.
All right, let's talk about women now. What are the signs of hypogonadism in women?
Okay, so if it starts before puberty,
Yeah.
you might see a delay in breast development.
Okay.
And they might experience primary amenorrhea,
Which is
meaning they haven't started their periods yet.
by the age they're supposed to.
Exactly.
Okay.
And then in some cases, especially with Turner syndrome that we talked about earlier,
Right.
they might be shorter than expected for their age.
Okay, so that's one of the signs of Turner syndrome.
It can be.
Yeah.
And then for adult women who develop hypogonadism,
Yeah.
their periods might become irregular
Okay.
or stop altogether.
Which is called?
That's called secondary amenorrhea.
Okay.
And they might also experience a low sex drive,
Right.
vaginal dryness,
Okay.
which can make intercourse painful.
Okay.
And then some of those classic symptoms of low estrogen,
Yeah.
like hot flashes and night sweats.
Right, right.
And just like men, they can be at risk for osteoporosis,
Okay.
and they might have trouble getting pregnant.
Okay, so fertility is a big concern for both men and women.
Absolutely.
Yeah. Okay, so let's say you're experiencing some of these things.
Okay.
You go to the doctor. How do they actually figure out if it is hypogonadism?
All right, so the main way we diagnose this is through blood tests,
Okay.
specifically looking at hormone levels.
Makes sense.
So in men, we'll check the levels of testosterone,
Okay.
total and free testosterone.
Okay.
And if it's primary hypogonadism,
Yeah.
we'll usually see low testosterone,
Okay.
along with high levels of LH and FSH.
Right, because the brain's trying to rev things up,
Exactly. The brain is trying to get those tests working.
but they're just not responding.
Exactly.
Okay.
But if it's secondary hypogonadism,
Yeah.
the testosterone will be low,
Okay.
but the LH and FSH will also be low or in the normal range.
Okay.
Because in this case, the signal from the brain just isn't strong enough.
It's like a weak signal.
It's a weak signal, yeah.
Okay.
And the same pattern generally holds true for women.
Okay.
So we'll look for low estradiol,
Yeah.
which is a type of estrogen.
Right.
And if it's primary hypogonadism,
Okay.
like let's say in Turner syndrome,
Right.
you'll usually see low estradiol and high LH and FSH.
Because the ovaries aren't responding.
That's right. The ovaries aren't picking up the signal.
Right.
But if it's secondary hypogonadism,
Yeah.
the estradiol will be low,
Okay.
but the LH and FSH will be low or normal.
Because it's coming from the brain.
Exactly. The
Yeah.
brain isn't sending out a strong enough signal.
Right. So it's really the combination of the sex hormone levels
Yeah.
and those LH and FSH levels
Yeah.
that really helps to distinguish
It helps to paint the picture.
right between primary and secondary.
Exactly.
Okay, so we've got the hormone tests.
Right.
What about those other tests you were talking about earlier?
Yeah. So those additional tests are really helpful in figuring out what's causing the hypogonadism in the first place.
Oh, okay.
So for instance, we might check your prolactin levels
Okay.
to see if high prolactin is contributing to secondary hypogonadism. We might do thyroid function tests
Oh,
to rule out other conditions that could be causing similar symptoms.
got it.
If we think hemochromatosis might be a factor, we'll check your ferritin levels.
Ferritin levels. Okay.
And for those congenital conditions
Yeah.
like Turner or Klinefelter,
Right.
we can do genetic testing.
Okay.
And if we're suspecting secondary hypogonadism,
Yeah.
we might do an MRI of the brain
Okay.
to look for any tumors or abnormalities in the hypothalamus or pituitary.
Right. So it's not just one and done.
It's a bit of a detective process.
It's more investigating.
Yeah, to
Right.
find the root cause.
Right. So we've got the diagnosis.
Right.
Now what about treatment?
Okay. So how we treat hypogonadism really depends on
Yeah.
whether it's primary or secondary
Right.
and what the underlying cause is.
Right.
So for primary hypogonadism in men,
Yeah.
the main treatment is testosterone replacement therapy,
Okay.
or TRT.
TRT.
And there are a few different ways to do this.
Okay.
You could have injections, gels you rub on your skin,
Right.
or patches.
Okay.
And it's really important that your doctor monitors you closely if you're on TRT.
Right.
So things like your prostate health,
Okay.
any potential cardiovascular risks,
Right.
and your red blood cell count.
Okay. And for women with primary hypogonadism, what are the options?
So for women, we often use estrogen progesterone therapy,
Okay.
or HRT.
HRT.
And this can help with bone health,
Okay.
may offer some protection for your heart,
Right.
and can help with those pesky symptoms like hot flashes.
Okay.
We also usually recommend calcium and vitamin D supplements
Yeah.
to help with bone density.
Okay.
And then if a woman with primary hypogonadism wants to have children,
Right.
assisted reproductive technologies might be something to consider.
Okay.
But that's
Great.
definitely something to discuss with their doctor.
Okay. And what about treatment for secondary hypogonadism?
Okay, so for secondary hypogonadism, the first thing we need to do is figure out if we can treat the underlying cause.
Right. Go to the source.
Go to the source.
Yeah.
So for example, if it's a pituitary tumor,
Yeah.
treatment might involve surgery to remove it
Okay.
or medication to shrink it.
Okay.
If high prolactin is the culprit,
Right.
there are meds to lower those levels.
Okay.
And for both men and women with secondary hypogonadism,
Yeah.
if they want to have children, we can sometimes use gonadotropin therapy.
Okay.
And this uses medications that basically mimic the effects of LH and FSH,
Oh, wow.
which directly stimulates the gonads.
Right. So you're kind of giving them a boost.
Exactly. We're giving them a little help.
Yeah.
And then lastly, I think it's super important to remember that lifestyle changes can play a role too.
Oh, right. Yeah.
Yeah. So managing your weight,
Okay.
cutting back on certain meds if they're contributing to the problem.
Like those opioids you mentioned.
Exactly.
Yeah.
And if you have any underlying health conditions,
Right.
managing those well can make a difference.
Okay. So it's a multi-pronged approach.
Yeah, it's about looking at the whole picture,
Right.
not just the hormones themselves.
Okay. So to really wrap our heads around this,
Okay.
can we do like a speed round
Sure.
of the key differences between primary and secondary just to
Okay.
really nail it down?
Okay, so with primary hypogonadism,
Yeah.
the problem is with the gonads,
Okay. Testids or ovaries.
testes or ovaries, yeah.
All right.
But with secondary hypogonadism,
Yeah.
it's the hypothalamus or pituitary in the brain.
Right.
And because of that,
Yeah.
in primary hypogonadism,
Yeah.
we see high levels of LH and FSH.
Because the brain's trying to kick things into gear.
It's sending out those SOS signals.
Yeah.
But with secondary hypogonadism,
Yeah.
LH and FSH are low or normal.
Right. Because it's not sending a strong signal.
It's a weak signal.
Yeah.
Okay. Now, in both types,
Yeah.
the sex hormones themselves are low.
Right. So low testosterone or estrogen.
Exactly.
Right.
Some examples of what can cause primary hypogonadism.
Yeah.
Klinefelter syndrome, Turner syndrome, damage from infections like mumps. And for secondary hypogonadism,
Yeah.
things like Kalman syndrome, pituitary tumors,
Yeah.
high prolactin levels.
Okay.
And then for treatment with primary hypogonadism,
Yeah.
we usually go straight to hormone replacement therapy.
And give them that boost.
Yeah, to replenish those low levels.
Right.
But for secondary hypogonadism,
Yeah.
we try to treat that underlying cause first.
Right. Fix that root problem.
Exactly. And then we'll add hormone therapy if needed.
Okay. That makes a lot of sense.
Yeah, it really helps to think about it.
Yeah.
In terms of where the problem originates.
Yeah, absolutely.
It makes all the difference.
Okay. So in this deep dive,
Yeah.
we have covered so much ground.
Yeah.
from what hypogonadism is
Right.
to all the different causes,
Yeah.
the symptoms,
Mm.
diagnosis,
Yep.
treatment.
The whole shebang.
Yeah.
Hopefully this gives you a good starting point.
Yeah, good understanding.
Yeah, to really understand this condition.
And as always, we have to say, this is all for informational purposes.
Absolutely,
This is
definitely.
not medical advice.
Nope.
If you are having any concerns about your own health,
Yeah.
if you think you might have some of these symptoms,
Definitely talk to your doctor.
you need to talk to a doctor.
100%.
Get a personalized evaluation.
Yeah.
Get the right tests.
Right.
Don't just try to figure this out on your own.
Absolutely not.
Okay, so as we wrap up this deep dive on hypogonadism,
Yeah.
I've got one last thought for you to ponder.
Okay.
We've talked about how all these different things can affect your hormones.
Right.
From your genes
Yeah.
to your lifestyle to other health conditions.
Absolutely.
So what other health problems that you might not think are related to hormones
Interesting.
could actually be affected by your hormones?
It's a good question.
It really shows how interconnected everything is
It does.
in your body.
It's all part of the same system.
All right. Thanks for joining us on this deep dive.
Thanks for having me.
We'll see you next time.
See you later.